All they're gonna do is just, instead of marketing the medicine on television, they'll market it to the doctors.
What I'm saying is, because that already happens, and healthcare, they spend a lot of money on this. The pharmaceutical companies, I mean, billions. So what I'm saying is, outlaw that, outlaw the ads on TV, and just say we're going to go with a health information technology system. And that's it. It'll create a lot more efficiency, and it'll mean that medications will either be that much cheaper.
So how would you suggest that doctors are exposed to new medication besides just going through pages of medical journals?
Through a national system that is doing health information technology. It could be a private-public sort of partnership. You could definitely come up with a creative solution that's way better than what we're doing right now. What we have now is complete, total chaos.
You know what would be better? Single payer.
No, single payer would be bad.
No, you want to know why? Because
hold on, can I get my last reform out?
Yeah.
All right. We should regulate what medical advances can actually get a patent or a partial patent. We shouldn't just give a patent to anything, especially when the medication is pretty useless or it only extends someone's life by like a week. Obviously, spending that much money is just harmful. That's it.
Joey, you neglected to mention that Obama caved in to the pharmaceutical industry and would not allow the United States to import drugs from other countries, such as Canada.
That was the right call.
That was the right call?
Yeah.
Why is it the right call?
Because that would defeat the whole ability for pharmaceutical companies to profit.
The fuck?
It would take
but do you guys see the amount? Like, pharmaceutical companies aren't going to get investors to invest in them. They're not going to have the incentive to put all this money into scientists.
That's the problem with our healthcare system right now. Is because
so what would you replace that with? How would you get these basic research discoveries turned into real products? And keep in mind, it costs over $1 billion
started at university level.
Socialism.
Started at university level.
The universities the universities already do basic research. That already happens.
Yeah, they do.
Did you guys see that recent TED Talk by Jack Andraka, like 16-year-old kid that found a biomarker? Well, he did tons of research, got a biomarker, got a little test, went to somebody's lab, did all the research, and if half of what he said is true, it's absolutely amazing what this kid did. So he found a way that's like ridiculously cheap to detect pancreatic cancer early when you can actually cure it. And he did it at such a low cost. I don't believe any university researcher, any NIH grant, any pharmaceutical or medical device company is actually geared and actually has the incentives to really develop something so revolutionary and cost-saving, because once you do,
you lose money.
You do lose money on certain other things. So do we really trust the system of the NIH, because of everything that's going on?
Yes, because somebody else who's not already profiting off of those products, someone else will come in there and invest in it instead and make a lot of money.
Joe, can I ask you a question?
It's the creative destruction of the medical industry.
But this kid says it costs 3 cents for each one of these little tests. You really think...
Well, it's not going to cost 3 cents in the beginning. I mean, they're going to mark it up because it'll have a patent. I mean, they'll charge you like $2 or something.
It's better.
If it only costs them 3 pennies to do it, and they charge it for more, then they'll profit off of it.
And I think that's
and they'll
another
have to pay that kid a lot of money too.
That's another flaw. So you just said, oh, they'll patent it. Like, the American mind is so geared to, oh no, I created this to help save lives. No, I created it to make money.
Right.
Well, the guy that did the polio vaccine, Salk, I saw a poster. I don't know if it was accurate, but they said that he lost out on $7 billion of revenue by letting the polio vaccine just go to the public and save lives.
That's really noble. No, but what I'm saying is, if this needs someone to invest in it, they'll invest in it and sell it for more than 3 cents a pop.
Because we need people to invest, because getting money out of society just because you already have money is a more noble and productive goal for society rather than just giving it to people, right?
Okay, so what would be your alternative? Who's going to invest in this?
The government.
Yes.
Socialism.
Oh, okay, great. So we're going to increase government spending. So, okay, so do you want the government
yeah, but you know how
to pay for applied...
Hold on, Joey, shut up for a second so I can tell you why single payer is better.
Okay, try to do that.
Administrative costs. Right now, they're like, what, 16 or like 20, 30%? Like
16 on average, I think, yeah.
Yeah, and on a single payer, what's the average?
I want to say 4.
Yeah, it's about 3 or 4.
Okay, so that's a huge advantage. Do you got anything else?
Well, to respond to that.
Okay, all right. Okay, here's my response.
Why do we need these people? These people are supposed to be saving lives.
This is serious.
People in the healthcare industry
you're saying, hey, let's give the responsibility of funding healthcare every year to Congress. Okay, these are the people who cannot adequately fund basic research. They cannot adequately fund infrastructure. They cannot adequately fund education. And you want to give them health care? And here's the thing. America's Congress is bad, but look at Britain. Look at Canada.
Hold up.
Wait,
Who passed Obamacare?
Democrats.
The same Democrats. It was Democrats.
Not Congress.
Not Congress.
Yeah, but even in the process of doing that, they still cut spending in other areas to make up for it. No, because here's the thing. Healthcare is getting more expensive every year for 20, 30 years, however long it happens.
Because we're not giving pharmaceutical companies enough money to develop the drugs fast enough to... Pharmaceutical drugs only take 10% of healthcare costs anyways. 40% is hospitals. We should talk a lot more about hospitals than pharmaceutical drugs. That's one big problem with American media on this issue, but keep going.
I agree with that, but I'm just telling you, you give Congress the responsibility to fund something, and they will find a way to fund it too little because they'll get all upset about one thing or another, and they'll cut spending, and they will refuse to raise taxes even if that's what needs to be done, and you will see healthcare quality go down. We've seen this in Britain. We've seen this in Canada. Okay, like
promote the general welfare.
If you want to see countries where healthcare is high quality, look at France. Look at Germany. They have private insurance systems. They have highly regulated systems, but private insurance systems where it's not Congress's responsibility. It is not single payer. Otherwise, I think single payer would be great, but political realities are Congress is way too incompetent to fund this.
Yeah, I agree with that.
Well, I mean, as long as Congress is this incompetent and corrupt,
it's our fault for electing these incompetent people.
Here's the thing: if healthcare costs start to go down as a percentage,
so incompetent.
If healthcare costs stop growing faster than the economy at large, then I think single payer starts to look pretty attractive, in some form or another. Yeah, if the
inflation stops,
if the economy were to start growing faster than healthcare,
why would that be attractive for single payer?
Because then I don't think Congress would underfund it. I think Congress will underfund it as long as it's growing faster than the... the thing is, they will underfund it if they have to raise taxes.
As the baby boomer generation starts to...
Yeah. I think that eventually it'll happen, but I don't think it's going to happen in the next 20 years.
I mean,
we spend around 18% of our GDP.
The baby boomer generation, they're getting old. I mean, the next 20 years is probably their last years, and aren't they?
Well, that's what I'm saying. I don't expect
population bulge.
I don't expect price. I don't expect healthcare to shrink as a percentage of the economy in the next 20 years. That's what I'm saying.
Yeah, no projection for that. No, I think the logic is on the other end. But anyways, I don't think single payer doesn't look likely for the United States. Maybe it could happen, but I see single payer as a potentiality if healthcare inflation is high as a way to save money, like administration costs, negotiation costs. Medicare is a big player in the market. They can make moves because they spend so much government money. So if you have single payer, then you can actually control prices. But there's all this talk of single payer. Well, there was a recent article out in Time magazine, and there was a little write-up about it in Incidental Economist. The guy who wrote it for Time was Stephen Brill. And the critique of it in the Incidental Economist was that the guy never mentioned the word all payer. Now, what all payer is, there's single payer, there's all payer. What all payer means is there are different people who buy the insurance products. There are different third-party payers. There are different insurance providers. So there could be private healthcare insurance companies. Like in Germany, there are lots of private healthcare insurance companies. In Japan, for example, they have all payer. What all payer does is it says, hey, here are all the services. Here is a knee replacement. Here is an x-ray. Here's an MRI. All of them have the same prices. I don't care if you're Medicaid, Medicare, private healthcare insurance, S-chip, whatever, all of you guys are on the same fee schedule and you all pay the same price. But the system we have now is that sometimes hospitals who do make a lot of this money, they game the system. If they have Medicare patients, there was a great article written by Atul Gawande in 2009, sometimes they just totally take advantage of the fee for service and just totally pour through volume. They would get Medicare patients and call them and say, hey, come in so we can check your blood pressure, so that they could bill Medicare. So the Medicare people in the Medicare market in McAllen, Texas was double that of El Paso, even though they had the same demographics, same everything. And you see absolutely zero difference in health of the population, but they were spending twice as much per capita on Medicare. So sometimes hospitals take advantage of Medicare, sometimes hospitals take advantage of the private healthcare market, but hospitals are making their money. And I want to
the
thank.
article where they were talking about the cups, the look, they were charging people like $100 for a cup of pills.
Yes, it's stuff like that. Exactly.
Yeah.
Exactly.
In the extreme.
Exactly. Yes, it happens. And so
No, they have standardized prices of what they pay for it. It's not in the extreme.
They had extreme examples where they're charging like $2,000 for a cup, things like that.
When you're in a hospital bed, it's gonna
$80 for a ham sandwich.
Yeah.
well, if you look at that helps innovation.
That helps innovation.
That kind of stuff is actually being gotten rid of in Obamacare, but not price discrimination at large. Yeah, the kinds of healthcare, the kinds of healthcare plans that were really cheap, but you have to spend all that money. That kind of stuff is going away, but it's still going to be the case that Medicare. Well, I mean, you gotta look at it, man. So the thing is, Medicare and Medicaid are still
you sound
going.
all shifty when we start pressing you on specifics.
I'm serious.
You're looking at it right.
I didn't think anybody was going to question that, but I guarantee you, if you look it up, that's going away with Obamacare. But what isn't going away is that Medicare and Medicaid are still going to pay lower prices than private insurance companies. And that's because Medicare and Medicaid are paying less. It means that private insurance is going to be more expensive.
And why do they pay less for the same
because Congress underfunds things.
That's ridiculous.
Wait, no, hold up. What? No, why does the MRI cost less for Medicare than it does for me?
Because Medicare is designed to pay less than what it should actually cost.
The government gets a discount, huh?
No, I'm serious.
No, then why?
That makes so much sense.
Because Medicare takes into account most of the cost, but it doesn't take out a few additional things, and so that additional stuff goes to private insurance.
Joey, these people do not have.
All right, well, how come? All right, here's a question then. How come in the United States it costs about an average of $510 for a CT scan? In Argentina, it costs $78.
Because in Argentina, they're not paying the true cost of it. Actually, the Argentinians are taking advantage of the American system by effectively making us subsidize all the research and development, and we have the productive economy.
Thank you, Joey. Tess.
Hold on. I mean, I don't blame Argentina. I mean, because they're a pretty poor country. I don't think they would be able to afford to put much into the research. But yeah, it's the same thing for pharmaceuticals. Same thing for healthcare devices. We pay more for healthcare devices in this country because we're paying for the full cost of research and development. And if you have a better way to fund the research and development of these products, tell me. I mean, like
well, here's another thing. Another thing that makes no sense. Why do all these non-profit hospitals have operating profits of like $769 million?
Which ones?
Well, that one would be University of Pittsburgh Medical Center.
Okay.
That's the highest. It's got the highest CEO compensation.
There are some
that definitely
that make accounting profits, but then they invest that in expanding the hospital, and then there are others that are universities, and they use that to subsidize their research or their education.
All right. Well, I'm just gonna go ahead.
And I personally don't think that's like a horrible thing.
All right. Well, here I'm gonna go ahead and have this lead into our